Good morning to our listeners in North America and around the global. This Ramadan, our theme is Ramadan Healing Under Corona. Our radio and online team have been diligently working to educate you about the latest COVID information by inviting experts from various medical and public health backgrounds, an effort to help the community overcome this hardship. Today, we are honored to have with us Ms. Denise Fair, who is the Chief Public Health Officer for the City of Detroit. She leads the city's program to protect the health and well-being of all residents, including COVID-19. Also with us today is Mr. Sufian Nabhan, the Director of the Islamic Center of Detroit. Our guest will shed light on the Detroit Health Department major vaccination outreach week to 8 neighborhood sites, including the Islamic Center of Detroit, scheduled for Thursday, April the 15th. Stay tuned after quick commercial break.
While we've been staying safe at home, scientists have been on a journey. The destination, a COVID-19 vaccine. This journey began decades ago with research into other coronaviruses. Scientists built from there with months of research and development, cooperation with other experts worldwide, and clinical trials on tens of thousands of volunteers of diverse race, age, and health status. They arrived at a safe, effective vaccine, and hundreds of thousands in Michigan have already been vaccinated. But the next step is ours. We need to get the vaccine when we can. Keep wearing masks correctly and taking precautions until we reach our destination, freedom from COVID-19, and getting back to the lives we love. Discover the facts for yourself at michigan.gov/COVID vaccine. A message from the Michigan Department of Health and Human Services.
Good morning, Ms. Fair and Mr. Nabhan. Welcome to the show.
Good morning.
Good morning. Hi, thanks so much for having us.
I would like to start with you, Mr. Nabhan, as we started Ramadan on Tuesday, a couple of days ago, and this is the second Ramadan during the crisis of coronavirus pandemic. Last year, we did not enjoy our usual Ramadan activities. Are there any changes this Ramadan or this year to the rules on social gathering and interaction this Ramadan for Muslim Americans, both vaccinated and unvaccinated?
Yes, Assalamu alaikum. Ramadan Mubarak for all the community. Thank you, Sister Leila, for hosting us. Yes, Alhamdulillah, this Ramadan we are opening our masajid for the prayers. Last Ramadan we did not pray at all. We closed our masajid for all activities. This year, most of the masajid, ICD included, we are opening our masajid for the prayers, although all the other activities is online, still online. But the prayers, the 5 prayers, the Tarawih prayer is at the masjid, and we are taking care of all the regulations that the CDC and the health department advised us. 6 feet distance, you have to wear your mask, you have to bring your rug to pray on, and you cannot eat or drink inside the masjid.
Great. This is very great news. I mean, giving hopes to our community during this holy Ramadan.
Yes.
Thank you so much for spreading the hope as well. Ms. Fair, unfortunately, the number of COVID cases on the rise in the United States and especially in Michigan. Why do you think Michigan has maybe one of the highest COVID cases right now?
Well, first, thank you again for having me. Let me just say that I'm really disappointed by our numbers, especially in the city of Detroit. We have been the national example for over the last year. But in the last 30 days, we've had more people in the hospital than ever before. Our percent positivity has more than quadrupled. We're now at about 20%. And the number of cases every day seems to get more and more. We're at about 700 cases per day. And when we look at our cases, 40% of those who are testing positive are between the ages of 20 to 40 years old, and we didn't see that last year. So I'm really encouraging everyone to get vaccinated now. In the city of Detroit, we've made it so easy for people who live or work in the city of Detroit to get vaccinated. And they can call us right now at 313-230-0505 to get their vaccine appointment.
So do you think the Michiganders can play a bigger role in helping slow the spread of the virus, including getting vaccinated as soon as possible? This is the only way we can do it?
Yes, I mean, I think the vaccine is definitely the answer to our prayers, but in addition to the vaccine, I'm encouraging everyone to still follow those safety precautions that we have been doing for the last year, which is to practice social distancing, to still wash our hands, and to wear our mask, but also being mindful. I love to celebrate with my friends, but I do that in a very safe manner outside with masks. So I'm encouraging everyone to be good citizens and hold each other accountable because we are experiencing pandemic fatigue. Getting the vaccine is the best way for us to get back to normal.
Mr. Sufian, let's talk a little bit about the vaccine. Why is it so important that our communities get vaccinated as soon as possible?
It is extremely important for our community to get vaccinated because we want to get back to our normal life, because we would like to get back to celebrate Ramadan again together. We would like to break fasting as families and community at the Islamic centers as we used to before. We would like to celebrate the Eid, which is coming on May 13, in a very safe way. So it is important for us, for our community, for everyone to get vaccinated. So inshallah that we can come back again and live our life as normal as before, inshallah.
We're going to come back to celebrate Eid together later on, Mr. Sufian. But my question, I'm going to move to Mrs. Fair right now. What is the vaccination target that will allow us to get our lives back? You mentioned that we want to celebrate with our beloved one. We wanted to go back to our normal life. My understanding, the goal of the city of Detroit to get everybody vaccinated for 70% of the maybe residents.
That's correct. So we want to get to community immunity, which is 70% of all Detroiters. Right now, we're right around 25%. So we do have a long way to go. So I do encourage you, if you're listening right now, give us a call. It's one number for any one of our vaccination sites, 313-230-0505. In fact, today we're going to be at the Islamic Center of Detroit from today, 8 o'clock until 5 p.m. So come on down and get your vaccine appointment.
So what is the city is doing to make getting vaccinated easier and more convenient to the residents?
So access definitely is not a problem in the city of Detroit. We've made it possible for those who live and work in the city of Detroit to go to the TCF Center downtown, whether it's drive-through or walk-in. You can also go to any one of our Saturday locations at local churches. But also this week, we've launched Neighborhood Vaccine Week. So we're bringing the vaccine directly in your neighborhood at a local school in addition to the Islamic Center of Detroit. So every day until Friday, you can give us a call, again, 313-230-0505, and come to any one of our vaccination sites.
Can you please tell us a little bit about this campaign specifically for the Neighborhood Vaccine Week, reaching out to the communities, different communities, including the Islamic Center of Detroit?
Absolutely. So again, our goal is to bring the vaccine directly where people are. We know there may be some people who may not want to go to the TCF Center because it's downtown, it's far away maybe for some people, or it may be just difficult to navigate. That's why it was so important for us to bring the vaccine right in everyone's neighborhood. And so in Detroit, there are 7 city council districts, and we were intentional about putting a site in every single center, especially with the Islamic Center of Detroit. There's really no waiting at all, so you can come and get your vaccine. It'll only take about 20 to 30 minutes. We'll have a nurse there who will administer the vaccine, and then she'll observe you there for about 15 minutes, and then we'll send you on your way. So it's definitely the right decision, so please come and get your vaccine today.
Thank you so much for this great information. Mr. Sufian, why did the ICD decided to participate in this great vaccination effort?
ICD always with the community and for the community. We, for example, our employees and board members, 90% of all our employees, ICD and board members already got vaccinated with Pfizer or Moderna. So we serve ourselves. Saving life is very important. Saving the community is extremely important. Right now, this is the only way that we can fight Corona. So this is COVID-19. So we need to educate the community that Please take advantage of what is going right now. Don't listen to some rumors that has no sense and no science base. Please come get vaccinated at ICD today from 8 a.m. till 5 p.m. We are here waiting for you. Protect yourself, save your life, then save your family life and your beloved ones when you meet with them. Getting vaccinated is really saving lives.
So I had to agree with you that we consider ICD to be one of the most important religious and social community centers in Detroit. It is very important, as you mentioned, Mr. Sufian, that our community leadership be involved in educating the community about the importance of vaccination. So what's the role of the imams during this holy month of Ramadan?
Alhamdulillah, most of the imams I know, I can't say one imam that I know that did not get vaccinated already. And the imams did meet and issued a fatwa, a statement that getting vaccinated during the month of Ramadan will not break your fast. Get vaccinated, save your life, and keep going fasting. So this is very important. Our imams, even on the Friday ceremonies and on daily ceremonies, they are encouraging all the community to please get vaccinated. There is some rumors sometimes that it's not halal. It has some vitamins or something in it that's not halal. This is not true at all. It's been tested. Our Muslim doctors with our
it's not going to break our fast, right? So it's nothing like this.
Exactly.
Yeah. Ms. Fair, how can people be interested now and listening to us in the city of Detroit in getting vaccinated make an appointment?
So it's so simple. In the city of Detroit, we have one phone number. It's 313-230-0505. So if you're listening to this radio show, if you live or work in the city of Detroit, you can give us a call. Again, 313-230-0505. We have multiple options for you to get vaccinated. So you can go to the TCF Center, which is downtown, or it's drive-through or walk-in. You could go to our community Saturday sites at local churches, or today. Again, you can go to the ICD and you can go and get your vaccine. Again, so simple. You don't have to go online. You don't have to wait in long lines. You don't have to wait for 30 minutes or 45 minutes to get a phone call through. You just call us right now, 313-230-0505 to get your vaccine.
Mr. Nabhan, I would like really for you to mention the address and the phone number if our listeners want to take more information about today's campaign focusing on being in the Islamic Center of Detroit, getting specifically Moderna and Pfizer. My understanding, only those two vaccines will be available today. Not Johnson & Johnson. Am I correct?
Right. Yes. So today we're at ICD. We're giving Pfizer, which is, as far as I know, is the best exist for vaccination. So today we're giving Pfizer at ICD. Yes.
I'm going to go back with you, Ms. Fair, specifically for Johnson & Johnson, why it's being held by the CDC and why the recommendation right now in only to get Pfizer and Moderna. Mr. Nabhan, can you mention the phone number and the address, please, to our listeners, and what hours they can be there and they need an appointment or walk in it?
The Islamic Center of Detroit is 14350 Tireman Avenue, Detroit. This is on Tireman between Chase and Schaefer. Between Chase and Schaefer and Tireman, you cannot miss it. It's a big building, Islamic Center of Detroit. The phone number, if you would like to call, as Mr. Dennis said, 313-230-0505. And the ICD number, for those who would like to speak Arabic or take more information, you can call us, 313-584-4143. We are giving the vaccines right now till 5 p.m. So please hurry up. From now till 5 p.m. we are already here.
So no need to appointment, no need to call in, just walk in it, right?
We take an appointment.
Okay.
But those who miss the appointment, they can come to ICD. Hopefully we can manage to get them through. But please call the office, make an appointment, then come.
Ms. Fair, I mentioned that based on the recommendation of the CDC, Johnson & Johnson being held we're using only right now Moderna and Pfizer. Why that?
So it's important for me to say two things. First, it doesn't matter which vaccine you choose, Moderna or Pfizer. They're both very safe. They're highly effective. There really is no best vaccine. The best vaccine is the one that's available to you. So I do want to make sure that's clear, that both vaccines will prevent death. They'll prevent you from going to the hospital. With Johnson & Johnson, there were 6 cases of women between the ages of 18 to 48 who had complications. They experienced blood clots, and 1 patient did die. And so because of that, out of an abundance of caution, there is a pause right now on using Johnson & Johnson. So we're just going to wait. We've administered about we've vaccinated about 125,000 Detroiters so far. 98% of those Detroiters were vaccinated with Pfizer and Moderna. So that's really not going to interfere with our strategy. Again, we just want people to get safe, and we want them to get vaccinated.
Thank you so much for clarifying this regarding Johnson & Johnson. Mr. Nabhan, my final question, how can we work together as a leadership and media to spread the message? It is very important to keep educating our community.
100%, I agree with you. Education. Spreading the word by by faith-based organization is very important because people trust it. Also by media outlets like your media, where it's very trusted in the community. We need to work together to make sure the right information, the correct information, delivered to the people.
I would like really to thank both of you before we end our interview today. Ms. Fair, any final word to our community today?
So I have just one message, and thank you again so much for inviting me. I want to remind people that we're still in the middle of a pandemic, and it's really up to you who are listening right now to make the choice. Make the choice to follow the safety precautions and get vaccinated. That's how we're going to get back to normal. That's how we're going to save lives. So please, give us a call. Get vaccinated today at the Islamic Center of Detroit by calling us 313-230-0505 to make your appointment.
Thank you so much. If you can stay with us for a few minutes. We have a caller here just asking question, if you don't mind.
Sure.
Hello.
Good morning.
Hello. Hi, Leila. صباح الخير.
صباح النور. Good morning.
أنا ضربت هاي الإبرة شو اسمها ضربت واحدة بس يعني.
Which one?
تقريبا هاي 15 يوم.
Which one?
هاي
Johnson & Johnson. Okay.
وما أعرف يعني يقولوا المو زينة.
Okay, I got it. I'm going to refer your question to Ms. Fair. Don't worry. Thank you so much for calling us today. Okay. Ms. Fair, she's asking about what's going to happen for her because she got first shot for Johnson & Johnson. Do you think something, hopefully not, it might happen to her by getting Johnson & Johnson?
So a lot of people have had Johnson & Johnson, and again, there's only been 6 cases that we are aware of, but if she has concerns, if she's experiencing any complications, please call her primary care doctor for next steps. But I don't think she needs to be worried, but again, out of an abundance of caution, that's why we were advised to not use Johnson & Johnson at this point. So I wouldn't panic at all. I would just, again, monitor, and if there's any changes in your body, please do call your primary care physician.
Thank you so much. للمستمع العزيزة التي تواصلت معنا الآن تقول مس فير أنها لن تشعر بالقلق الآن إلا إذا كان لديك بعض الخوف ممكن أن تتواصلي مع طبيبك الخاص وسؤاله، لكن إذا كنت ليس هناك أي أعراض سلبية وتأثير سلبي على عليك في المرحلة الحالية لا داعي للخوف مطلقا. هناك العديد من الأشخاص الذين تلقوا جونسون & جونسون والحمد لله لم يتعرضوا إلى أي ضرر، لكن إذا كنت خائفة وقلقة نوعا ما بإمكانك التواصل مع طبيبك الخاص primary doctor لك. Thank you so much Ms. Fair, Mr. Sufian, for reaching out to our Arab American community. We hope that through the great efforts to our governors as well as public health departments and community centers leadership, we will soon overcome this hardship together. Thank you so much, Ms. Fair, being with us today. And also, Mr. Sufian Nabhan, happy Ramadan, and thank you so much for taking from both your time to reach out to our Arab American community.
Wearing a mask is more than protection. It's a bridge to better days, the path back to celebrations with family. nights out on the town with friends, game days with your favorite sports teams, and the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful, because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
سريعا نلخص لكم فحوى المقابلة التي أجريناها. صحة ديترويت تطلق حملة لتوزيع لقاح فايزر لمدة أسبوع. أعلن مكتب عمدة ديترويت مايكل داغن أن وزارة الصحة بالمدينة قامت بتنظيم حملة لتوفير لقاح فايزر لمن هم في سن 16 عاما وما فوق، تحمل اسم نيبرهود فاكسين ويك. وبحسب البيان الإعلامي الذي تلقينا منه نسخة للحملة، فقد تم إطلاق الحملة يوم الاثنين 12 أبريل بالتعاون مع المركز الإسلامي في مدينة ديترويت والمنطقة التعليمية للمدارس العامة بالمدينة، على أن تستمر هذه الحملة حتى يوم الجمعة القادم في 16 أبريل. وأكد البيان أن الهدف من الحملة هو تلقيح 70%، كما أكدته اليوم لنا Miss Denise Fair, who is the Chief Public Health Officer for the City of Detroit. الهدف من الحملة هو تلقيح 70% من سكان ديترويت حتى يتمكنوا أن يعودوا إلى حياتنا السابقة مرة أخرى، وحتى يتم حماية أفراد المجتمع ليتمكنوا من الاستمتاع بالعيد، كما أشار اليوم الأستاذ سفيان نبهان مع نهاية شهر رمضان في 13 مايو. ستوفر وزارة الصحة خلال هذه الحملة 8 مواقع تطعيم إلى جانب المركز TCF ومركز نورث ويست اكتيفيتيز وعيادات السبت المجتمعية ومواقع التوعية المتنقلة خلال هذا الأسبوع لضمان حصول أكبر عدد من المواطنين على اللقاح. الحملة بدأت يوم الاثنين كما أشرنا في مدرسة هنري فورد ويسترن الثانوية، يوم الثلاثاء كانت في مدرسة راندلوف، الأربعاء توجهوا إلى أكاديمية بريندا سكوت ومدرسة كاستيك الثانوية. اليوم الخميس سيكون الموقع هو مركز ديترويت، المركز الإسلامي في مدينة ديترويت على تايرمان 14350 تايرمان رود. نعيد لكم اليوم الحملة في المركز الإسلامي في ديترويت The Islamic Center of Detroit وعنوانه 14350 تايرمان، وتختتم الحملة جهودها يوم الجمعة في مدرسة إيست إنجليش فيليج الإعدادية في ختام لهذه الحملة والريتش أوت والتواصل المجتمعي مع الجالية في مدينة ديترويت. نتمنى من مستمعينا التواصل والحصول على اللقاح مباشرة من الإسلاميك سنتر أوف ديترويت. سيحصلوا على لقاح فايزر كما أشار السيد سفيان نبهان، والآن الإسلاميك سنتر أوف ديترويت مفتوح بإمكانكم الاتصال على الرقم للمواعيد 313-230-0505 313-230-0505 وأيضا على المركز الإسلامي 313-584-4143. That's 313-584-4143.
ارتداء القناع ليس مجرد حماية، بل هو السبيل لأيام أفضل قادمة، سبيل العودة للاحتفال مع العائلة والسهر مع الأصدقاء في المدينة وتشجيع فريقك المفضل في الملعب وحضور الحفلات الموسيقية. ولكن إلى أن نتمكن جميعا من الحصول على لقاح كوفيد-19 وبناء مناعة مجتمعية، وهذا سيستغرق بعض الوقت، علينا جميعا الاستمرار في توخي الحذر، لأن تعافي ميشيغان يعتمد عليك وكذلك على عائلتك وأصدقائك وجيرانك. ارتدي الكمامة حتى بعد تلقي اللقاح، وتجنب التجمعات الكبيرة، وحافظ على التباعد الاجتماعي. وفي يوم من أيام المستقبل القريب سنضع جميعا هذا الوباء وراء ظهورنا، ولكن حتى ذلك الحين انشر الأمل وليس كوفيد. لمزيد من المعلومات ادخل على michigan.gov/coronavirus. رسالة من وزارة الصحة والخدمات الإنسانية في ميشيغان.